Measures to curb the spread of COVID-19 should have been introduced earlier. That's according to the most senior medical officer advising the government during the pandemic. Giving evidence to the public inquiry today, Professor Sir Chris Whitty admitted they were too late to act on the first wave of the virus.
So I was very aware that we essentially had two different things we were trying to balance. The risk of going too early, in which case you get all the damages from this with actually fairly minimal impact on the epidemic, and the risk of going too late, in which case you get all the problems of the pandemic running away. Now, as we will, I'm sure, come on to, my view is, with the benefit of hindsight, we went a bit too late on the first wave.
Chris Whitty also told the COVID inquiry that there were no good options on the table, but by March 2020, it was clear that if none were taken, the country would be in very deep trouble.
There were no good options. All the options were very bad. Some were a bit worse, and some were very, very bad. And the second is this was going to go on for a long time. So if you took an option, you had to be prepared to see it through for many months to years, rather than just seeing this as a temporary situation. And I think, again, this took a while for some people to internalise that this was not going to be in any way easy, and it also was going to be long, and it was also going to involve significant loss of life, almost irrespective, unfortunately, of whatever decision was taken, but where some decisions would lead to substantially worse outcomes from a public health point of view.
Joining me in the studio now, Chief Political Correspondent from The Times, Aubrey Allegretti. Thanks for coming. And we're also joined by NHS GP, Dr. Lawrence Buckman. So why don't we start with you, Dr. Buckman? If we're talking about a lockdown taking place too late, what scientifically or medically was not noted or noticed or allowed for or whatever? Because it's quite difficult as lay people to understand why Professor Chris Whitty now thinks it was too late.
I think he always thought it was too late, but he and the other people on SAGE, which is the advisory committee, had to take a view on what they told ministers. And then, of course, ministers have to make up their own minds based on a whole list of other things which are nothing really to do with the health service directly. And I think the mistakes were made very early when they decided they were going to go late rather than at the very beginning. And the scientific argument for doing that is not that you guarantee there won't be any cases, but that you make it less likely that the NHS will be overwhelmed. You spread out the work so that you don't have a deluge of very sick people, many of whom will be very elderly. And unfortunately, that's what happened.
I mean, we remember very clearly, obviously, the shock of being told that we were going to go into lockdown. And we remember people having, I think it was referred to at the time as one last hurrah. You know, people thought, right, OK, well, if I'm going into lockdown, I'm really going to absolutely cane it on the last night. Particularly, it seemed at the time, I don't want to stigmatise them, but young people who just thought, hang on, what is this? I'm going to be locked up. My God, OK, well, I'm going to go on a massive pub crawl. I'm going to, you know, deeply kiss and also have carnal knowledge of as many attractive strangers as I can. I'm absolutely going to, you know, really absolutely milk my last night of freedom before I then have to retire and subside into lockdown. Is that what you mean, that there was a kind of flurry of exchanges of virus before people locked down?
There was that. Certainly the idea that you could go out and have a great time, although I was pointing out at the time when I was working for the COVID service, that actually what you were going to do was end up killing a granny. The fact is, young people felt immune, and indeed the majority of them were, relatively speaking, and it was older people who took the brunt of the initial waves anyway. So it would have been better not to have done that. But of course, human nature is what it is. And if you think you're going to be locked up on Monday, you go mad on Sunday.
Yes, let me bring Aubrey into this. You feel, Aubrey, that Professor Chris Whitty isn't really going hard on Boris Johnson in the way that maybe other people testifying to the COVID inquiry have done, that he seems to show regret, but not necessarily judgment of the then Prime Minister?
Yeah, I mean, today's evidence session, we've had a lot less sort of fire, fury and brimstone than in previous evidence sessions. And I think that's partly explained by the fact that Chris Whitty is still the Chief Medical Officer for England, whereas some of the others we've heard from, they've left their posts. Patrick Vallance, I think, wrote a diary as well, which we've seen lots of extracts from Chris Whitty even today apologising almost for how sort of mundane and boring his WhatsApp seemed compared to some of his colleagues.
Yes.
But he has been basically making the point that there wasn't enough discussion at that initial moment before lockdown of the trade-offs of lockdown. And he was explaining that he saw it a bit like a doctor explaining a medical procedure to a patient, that you should explain the benefits, but you should explain the potential risks and disadvantages as well. That is how he has been justifying today the sort of decision to delay lockdown, at least at the first wave.
Dr. Buckman, I mean, you were talking about the medical side, of course, because you're a doctor, and saying that, you know, talking about the other side isn't really your forte, and that's not necessarily, you know, where you would engage in this conversation. But in retrospect, and of course hindsight's a delightful thing and an interesting tool to use, people are talking a great deal, aren't they, about the economic effect of lockdown, the psychological effect of lockdown, the effect on children, the effect on, you know, victims of domestic violence, the effect on the economy, the effect on the country in so many different ways. Many people very, very critical of the fact that we locked down at all, or that we locked down in the extreme way that we did. So from a purely medical perspective, ignoring that huge long list that I've just regurgitated for your delectation, would you still say on medical grounds alone, locking down was A, the right thing to do, and B, the only thing to do?
The thing to have done, of course, was to have had a public health service that worked and had not been dismantled by successive governments over the previous 20 years. So that's the thing that they should have done. But of course, there was no way to fix that in a week or two. The lockdown had to happen in order to prevent a shrunken NHS, which is what it is, from being absolutely swamped with large numbers of very sick people. You're quite right. There are spin-offs to being locked down that are not in anyone's interest. But unfortunately, if we put in the balance life versus liberty, I'm afraid, and you would expect me to say this, yes, life trumps it. And I think preventing people dying is what the health service is there for. Of course, there are other people who will take a contrary view. The economy got a massive hit from being locked down, but I would still contend that people who are alive can go back to the economy. People who are dead can't.
At the beginning of that last answer of yours, Dr. Buckman, you talked about, you said the first thing that really was needed, you said, and I'm paraphrasing, but was an NHS, a health service that hadn't been depleted over the years and was kind of robust and ready. And you said, I think, working, a fully working operational health service. That's the most important requirement. And your implication and statement says, well, they didn't have that. If we had had that, if the country had had that, what difference would it have made as the pandemic sort of took hold on our shores?
We'd have picked up cases much quicker. It's a public health service, not the NHS bit. The part of the health service that deals with the public health, in other words, the population health. And that is the thing that's been run down, broken up in little pieces. It's still there, but it's tiny now. It didn't have the laboratory facilities. Good examples of where they did have it in Korea, where they had those facilities and could stamp on outbreaks very quickly. The same in Germany, where they didn't have the public health facilities, but they had the industrial muscle to get them going very quickly. We had neither of those. We slowly dismantled our public health services, the bits that deliver to the community and work through councils and health authorities. And there was nothing very much left that could step into the breach. And had we had that, we'd have been able to pick out the people who were infected much more smartly and isolate them rather than the entire population. But the fact is, it wasn't there and they couldn't do it.
Professor Chris Whitty, Dr. Buckman, seemed to imply today that the model, the paradigm of pandemics used to indicate to the government and I suppose to the NHS what this pandemic was likely to be like and the kind of effect it was going to have was the wrong model. They were looking at the wrong pandemic. He said he came to realise they should have looked at influenza during the First World War, not whatever they had looked at instead. I don't know if it was SARS or MERS or whatever thing they were looking at, but whatever it was the wrong one. I mean, what happens when you're looking at the wrong model?
Well, if you haven't got any imagination and you just look at one thing rather than saying, well, we might be wrong about that, maybe we should look at something else a bit more carefully. If you have no imagination, then you end up with the wrong model. The model that was based in 2000, I think, in 2000, but it was updated in 2020, obviously. They were barking up the wrong tree. And that's what Chris Whitty said today. They had a model that was about a sort of slow moving epidemic, which this clearly wasn't. And they were banking on a variety of facilities in the health services that are not there. And as a result, they made a whole list of assumptions, nearly all of which were wrong and were obviously wrong. And when somebody said, well, we've got a plan, we know what to do. Well, no, they didn't know what to do.
Let me bring Aubrey into this. Aubrey, there's been an awful lot of debate following the pandemic about lockdown and about whether it should have happened or whether it shouldn't. On this particular station, talkTV, there are many seasoned broadcasters, many of them my friends and colleagues, who really are fundamentally, massively and dramatically opposed to lockdown having happened at all. But when you hear Professor Chris Whitty saying one of his deepest regrets and one of the most fundamental errors was that lockdown occurred too late, not that it occurred at all, but that it occurred too late. How do you feel about the numerous voices clamouring against all future lockdowns and saying that the one that we had was a terrible mistake?
Well, I think Chris Whitty was making the point that lockdown was a system that had never been tried before, but there were precedents for trying other what are called non-pharmaceutical interventions in previous pandemics. So schools had been closed, people had been urged to isolate. Those were the options that he sort of thought the government should have been looking at earlier. And we heard today, for example, about how he thought all arrivals from China in January 2020 probably should have been quarantined or asked to self-isolate. So there was more the government could have done earlier that wasn't just lockdown. Lockdown is not the sort of silver bullet and panacea. It's the situation we were almost forced into because there hadn't been other mitigations put in place earlier.
Dr. Buckman, when I was broadcasting, I'm sure you were my regular guest at the time on the BBC throughout the pandemic, numerous lovely listeners would just ring in and say, we just don't get how come these planes are landing here. We don't understand how people then have to walk through the airport. They used to, every day people used to say, and then they have to sit in a taxi or go on a train or a tube or a bus, for God's sake, with other people all around them, or we don't know what they're bringing in with them. I mean, that went on for months and months, didn't it? It seemed to make a lot of sense then. It still seems to make a lot of sense.
If we'd have done all the things we should have done early enough, lockdown would have been something that was quite a long way away. And we might have even managed without it, like many other countries managed without it, at least to start with. But we did none of the things that you need to do. And we also weren't ready. And the combination of a plan that wasn't real, a dismantled public health service that couldn't screen people, very slow decisions to, for example, not have Cheltenham races, yes, or not let people who've come from areas where it clearly had taken off to come to the UK. We're the hub of the world. Well, no, we're also the hub of the epidemic world, and I'm not sure it's an accolade we particularly want.
No, it certainly isn't. When you listen to the evidence and the stories told at the COVID inquiry, Dr. Buckman, then you will be aware, of course, that many people just don't think it's worth having the inquiry at all. They just think, all they really need to say is we made a tremendous mess of it. Thank goodness the vaccine arrived and delivered us from evil. Oh dear, we won't do it the same way again. It's going to be very expensive. It's going to be very long drawn out. And I think people can think of other things maybe they'd like to have done with the money and the time. Do you feel the same? Do you think this is pretty futile and expensive? Or do you think that the lessons learned will be learned?
Lessons are never learned. Whenever you hear the phrase lessons will be learned, you know for sure they won't be. But what will happen is that a very large number of bereaved families will get some answers to how come this happened. And I think they deserve it.
Thank you both very much indeed.